Hello everyone. Today I'm going to discuss the vaccines which are recommended for the pregnancy females. First of all, why the vaccines are given to pregnancy. Remember, pregnancy is a state of immuno-compromised state. That means the patient immunity is weakened and hence she is more susceptible to infections. To enhance her immunity, we give her these vaccines. The second main advantage of giving vaccines is that it provides a passive immunity to the baby. That means when you give a vaccine to the mother, she develops those fighting cells which are transferred to the baby. So when the baby is born, the baby is already having those fighting cells and that she can easily fight with the infections she is prone to just after delivery. So what are the vaccines which we give to all the pregnant females? The first is the tetanus vaccine. Remember, TT has been given since ages, but now it has been modified to TD. That is tetanus and diphtheria. It should be given at the first visit when the patient is coming to the doctor. The second vaccine can be given TD or it can also be given as tdap, in which the pertussis infection vaccine is also covered. Remember, there should be a gap of at least 6 weeks between these two vaccines. And also the second vaccine should be preferably given at least by 30 to 32 weeks. The second vaccine which is recommended for all females is the influenza vaccine or the flu vaccine. Because our country comes under an endemic area of the influenza infection, that is why all pregnant females are recommended to take this vaccine as soon as possible in pregnancy, and it is a single intramuscular dose. The third vaccine, as we know, after the COVID era, the COVID vaccines. Remember, 2 doses of COVID vaccines are given, which can be Covishield or Covaxin, whichever is available and affordable to the patients, but it should be taken of the same brand. The gap between the 2 doses should be at least 6 weeks. Also know that if a patient develops COVID infection during a pregnancy, then of course the vaccine should be given soon after her delivery. Also, if she had got infection before delivery, then at least a gap of 3 months should be there between the infection and the vaccination. Also, there should be a gap of at least 1 to 2 months between the period of recovery as well as the vaccination. Also know that all these vaccines are very safe and very effective for the baby as well as the mother. As such, there are no contraindications for them except if the patient is hyperallergic to these vaccines. For more details, contact your doctor. Thank you.